Hi everyone, welcome to the channel. This is Nurse Shock, your favorite ICU nurse and paramedic, and today we're going to be talking about Versed or Midazolam. So Versed, its chemical class is going to be a benzodiazepine, and its therapeutic class is going to be a sedative, hypnotic, and yes, it is a controlled substance. So indication is going to be for preoperative sedation, as well as mechanical ventilation sedation. Very rarely it can be used for RSI, which is rapid sequence intubation. So mechanism of action, it increases GABA, which is an inhibitory neurotransmitter in the brain. Side effects you definitely want to look out for is going to be hypotension and a decreased respiratory rate, contraindicated in any patients with glaucoma. So how are you going to find it? What's it going to look like? So Versed in an IV drip medication form is going to be a 1-to-1. So it's going to be 50 milligrams in 50 mLs of something like D5W, or it's going to be 100 milligrams in 100 mLs of something like D5W. So your bolus dose is going to be 2 milligrams and your titration dose is going to be 1 milligram per hour, and you can change the rate every 15 minutes for desired effect, typically for RAS scores of -1 to -3. So your maintenance dose is going to vary anywhere between 1 and 10 milligrams per hour, and your max dose is going to be 0.2 milligrams per kilogram per hour for up to 15 milligrams per hour. FYI, if you're weaning a patient off the vent, just use your nursing judgment or your titration orders. For example, if someone's on 5 milligrams per hour, typically you're going to lower them to like 2.5 and see how they react to that. Another piece of information, IV Versed and IV fentanyl are actually compatible. So if you only have one IV site, you can run them in the same line.